Hello, everyone. I am Emmylou Newell, Head of Infection Control at the Spokane Regional Health District, with a quick briefing about the disease Tularemia. Since we are approaching warmer weather months, I wanted to give you a heads up about this disease. Tularemia is an illness caused by the bacteria F. tularensis and is most commonly transmitted to humans through the skin when handling an infected animal. And one of the most common modes of transmission is through skinning infected rabbits, squirrels, or other rodents, and birds and sheep can also carry the bacteria. Tick and deer fly bites are very common modes of infection for humans and animals, and other animals such as domestic cats, dogs, and even hamsters are susceptible to tularemia and can pass it on to humans. One form of tularemia can become aerosolized and spread through inhalation of dust or chemicals in farming and landscaping, gardening, or when operating a tractor that runs over an infected animal or carcass in a field. Water can also be contaminated with the bacteria through infected animals, and fortunately, there is no human-to-human transmission of the bacteria. So there are 6 types of tularemia. The mode of transmission into the body and symptoms vary with each type and range in severity of illness. Almost all cases have a rapid onset of fever, chills, fatigue, and headache, but then the symptoms vary depending on the type. So you can see these 6 types here. I won't go through each of them, but interesting to note that ulceroglandular tularemia is the most common form, and it's typically with a skin ulcer that forms at the site of infection. Also interesting to note is the oculoglandular causes eye pain and redness and swelling because it impacts the eyes. So as you can see, diagnosing tularemia can be tricky. A blood test can typically diagnose it, but other bodily fluids can also be collected for sampling and sent to a lab with BSL-3 capabilities. Confirmed testing in Washington State must be performed by a Laboratory Response Network lab. It is diagnosed most common with a history or evidence of a tick bite or exposure to animals known to carry the bacteria or contaminated water or dust. The incubation period is 3 to 5 days, but has a range of 1 to 14 days. And treatment is with antibiotics that are given via injection or oral. In general, you're immune after you recover, but some people can get sick again, and there is no vaccine. Treatment usually lasts 10 to 21 days, depending on the stage of illness and the medication used. And symptoms may last for several weeks, but fortunately, the overall mortality is low, although 2% is still significant, and the range up to 24%, depending on the type of tularemia. So who is most susceptible? Our farmers, dairy workers, hunters, anyone that handles wild animals, veterinarians, and anyone that is around an area with ticks or deer flies. Anyone outside not protected with clothing or insect repellent. And then construction workers, gardeners, landscapers, anyone digging in the dirt or at risk. A tick bite is one of the most common modes of transmission of tularemia. In other parts of the world, mosquitoes have been shown to carry it, but not here in the United States. It is also very contagious in a lab setting, so lab workers are at risk. So prevention, what do we do to prevent this? Protect yourself from insect bites with clothing, insect repellent with 20 to 30% DEET or picaridin, wearing a face mask when excavating soil or clearing weeds or brush, and then handle animals carefully and just make sure to wash hands after touching an animal, especially something like a rabbit or hamster. Wear gloves if you are a hunter, trapper, or food preparer. Do not eat undercooked meat. Wild meat should be cooked to a minimum of 160 degrees Fahrenheit, poultry to 165. And also protect your pets. Keep them from eating a wild animal and from getting tick bites. And of course, avoid unsafe drinking water. Tularemia is actually endemic in Washington State. We have 1 to 5 cases typical per year, but some years up to 10 cases have occurred. Since we are approaching the summer months when most cases occur, June through September, we need to be aware of this disease as people spend more time outside. And F. tularensis is actually classified as a Category A agent for bioterrorism, which means it's of greatest concern because it requires a low infectious dose and can survive in the environment quite well. It can live for a long time in a carcass even, and it can be easily disseminated by aerosol. So Bioterrorism Act is definitely on the list of possible modes of transmission, so is something to be aware of. Here are my resources, and thank you so much for all the work you do in public health. Feel free to reach out to me if you have any questions. Thank you.